Hello, dear friends. Today, we're going to talk about a condition called pseudocystitis. Why this topic? Because unfortunately, the symptoms of pseudocystitis are experienced by almost 1 in 4 women. In the past, it was considered a problem of women approaching menopause, but today, these same symptoms are already appearing in women as young as 18 or 19 years old. What is pseudocystitis and why it's often misdiagnosed? Clinically, pseudocystitis includes 3 main groups of symptoms. 1. Symptoms related to vaginal atrophy. 2. Symptoms related to urination. And a third group, sexual dysfunction. Women often visit the doctor complaining of burning, frequent urination, or pelvic discomfort, but the urine test comes back perfectly normal. No bacteria, no infection, yet the symptoms feel identical to cystitis. That's why this condition is often misdiagnosed as cystalgia or bladder neurosis, when in fact it's pseudocystitis, a hormonal, not infectious problem. Group 1. Vaginal atrophy symptoms. These include increased sensitivity to chemical or physical irritants, itching, burning or dryness in the vagina, pain or discomfort during intercourse, swelling and tenderness in the vulva, slow healing of micro-injuries or post-surgical wounds, recurrent vaginal discharge, light bleeding from the vaginal mucosa, especially after intimacy. All these symptoms are linked to the thinning of the vaginal mucosa. As estrogen levels drop, the tissues lose elasticity, moisture, and protection. Group 2. Urinary symptoms. This group causes the most confusion because it mimics classic cystitis. Common complaints include frequent urination, more than 8 times a day, waking up at night to urinate, nocturia, urinating more often at night than during the day, nicturia, painful or burning urination without any infection, different forms of urinary incontinence. Examples: stress incontinence, urine leaks when coughing, laughing, or lifting something heavy, urgent incontinence, sudden, strong urge followed by involuntary urination, mixed form, both stress and urgency combined. Other related issues include recurrent urinary tract infections and overactive bladder syndrome, when a woman constantly feels the need to urinate even though no infection is present. Group 3. Sexual dysfunction. This group includes decreased libido, reduced or absent orgasm, pain during intercourse, and it's important to understand this is not a psychological problem. It's a hormonal and physiological consequence of estrogen deficiency. The root cause. The main and only true cause of pseudocystitis is estrogen deficiency, which results from dysfunction of the pituitary and thyroid glands. When estrogen levels fall, the lining of the vagina and urinary tract, called the urothelium, becomes thin and fragile. This reduces glycogen levels, and glycogen is the main nutrient for lactobacilli, the good bacteria that protect vaginal health. When lactobacilli decrease, the vaginal pH becomes more alkaline, and harmful microorganisms begin to multiply. That's the full chain reaction. Decreased estrogen, decreased glycogen, fewer lactobacilli, higher pH causes infections and irritation. Diagnostics. To confirm pseudocystitis, your doctor may recommend 1. Measuring vaginal pH. Normal levels range from 3.8 to 4.4, a healthy, slightly acidic balance. 2. Blood tests for hormones. TSH, thyroid-stimulating hormone, prolactin, DHEA sulfate, estradiol, E2, ferritin, iron, and vitamins A, D, C, B9, and B12. 3. Femoflor screen to evaluate the vaginal microbiome. 4. Vaginal health index and maturation index of the epithelium. 5. Urinalysis, urine culture, and kidney ultrasound, if indicated. If your tests for infection are negative but symptoms persist, see an endocrinologist or a gynecologist endocrinologist, not just a urologist. What affects vaginal pH and microflora? Using harsh soaps or regular body wash for intimate hygiene. Overusing antibiotics. Frequent vaginal douching. Hormonal imbalances and menstrual cycle changes. Chronic stress and fatigue. Poor ecology or immune deficiencies. All of these disturb the delicate acid-base balance and weaken the body's natural protection. Treatment. The later treatment begins, the harder it is to restore the mucosa. The body's response depends on the degree of atrophy. The main treatment is hormone replacement therapy, HRT, either systemic, tablets, patches, injections, or local, low-dose vaginal creams, gels, or suppositories. Typical regimen: daily use for 3 to 4 months, then 1 to 2 times per week for another 3 to 4 months, and then cycles repeated under medical supervision. Yes, benefits of local therapy: bypasses liver metabolism, minimal effect on the uterus, low hormonal load, no need for additional progesterone. Warning, however, every case is individual. Always start treatment only after consulting your doctor, preferably an endocrinologist. Conclusion. Pseudocystitis is not an infection. It's your body's way of saying, my hormones are out of balance. Don't ignore it and don't self-medicate. Timely diagnosis and hormonal support can restore comfort, confidence, and quality of life. Thank you for watching. If this video was helpful, please like, subscribe, and share it with someone who needs to understand her body better. Stay healthy, strong, and full of energy with Energy and Health.